New York State is implementing a strict COVID-19 protocol. As of today, all healthcare workers have to have at least one dose of vaccine. We're looking there at New York City Live, and watching it from Washington is our Magda Gabriselassie with more on this new protocol in New York City. Magda.
Heather, as you said, healthcare workers were required to have at least one shot of a COVID-19 vaccine as of today or risk losing their jobs. So what we know is that about 16% of workers in hospitals are unvaccinated. We're talking about 70,000 workers. When you look at long-term care centers for adult centers and nursing homes, the vaccination unvaccinated rate is even higher at 19 and 23%. This is all based on information that was released last week. Now, it's not known how many workers over the weekend decided to get their shots and essentially save their jobs. But for those who didn't do that and didn't have a medical exemption, well, they're risking their jobs right now. So here's some reaction from nurses on what this is going to mean for them and for the many centers that they work at.
You know, I'm scared because they're like threatening my livelihood. So that's, the whole thing is scary because I'm the breadwinner for my family. I carry the health insurance.
I believe that everyone from housekeeping, dietary, nurses, doctors, everyone has the choice, but because of this mandate, we're going to lose. Last I knew, it was approximately 400 employees.
Now, there was a federal judge that had asked for a pause to be put on the mandate for anyone that was seeking a religious exemption. So it's very possible that many people may try to apply for that. But for workers who, refuse to get vaccinated, didn't have a medical reason for it, and lose their jobs, they are not going to be able to get employment insurance, Heather.
What is the plan to deal with the staffing shortages? We're certainly dealing with those in Canada, but not unique to Canada. And what is the governor of New York's plan there?
Well, the governor says she may call for a state of emergency, and what that could lead to is pulling in resources from other states and even other countries. So that means, seeking the help of nurses and doctors from other locations, possibly pulling people in who may have retired, and even putting recent graduates right to work. Last week, she said she was still trying to convince healthcare workers to get vaccinated. Here is more from Catherine Hochul.
Every single person who ends up in your care has the right to know that they are as safe as they can be, that there is no chance that they will be infected by the person charged with protecting them and their health.
Now, some of the associations representing healthcare workers were in support of the governor, and they were hopeful that workers would, in fact, get out there and get their vaccines. And we're going to keep watching the story to see how many of those workers actually did that this weekend.
Sounds good, Magda. Thank you very much. Magda Gabriselassie